segment is sponsored by iChiro Clinics. Do you struggle with occasional back pain and wonder if your back is ever actually popping out of place? Well, Dr. Michael Quast is here to tell us that's actually a myth. So that is kind of crazy to me because I'm one of those people that's like, my back popped out. I'm very dramatic about it. And you're saying that that's not actually a possibility.
Yeah, I mean, it is a possibility, but very rare. If your back actually popped out of place, you would be in the ER paralyzed.
Yikes, okay.
So vertebrae don't pop in and out of place without severe traumas, but people have this perception that your back is actually having that occur, you know, just in everyday life stuff, and that's actually not what's happening. What's happening is you have these tiny little muscles that surround your spine. They're called deep stabilizer muscles, and when those muscles get injured from things that you do in life, you know, the slips, the falls, the shoveling, the gardening, you know, all those types of things, those muscles will spasm and they will tighten down, and then they'll actually pull and shift those vertebrae. Well, they're not popping out of place, they're just being pulled one way or another by muscle from things that we actually are all doing in life.
So how do you treat something like that then?
Well, what happens with the chiropractic adjustment is it's actually an adjustment to those muscles, and those muscles then reflexly relax, and the relaxation that's caused actually allows those muscles to calm down, and then the vertebrae are more in a proper alignment, and then that's how that is actually working. So most people think we're adjusting the bones, but we're actually adjusting the muscles that are holding the bones in the positions that they are.
So then what would happen then, because I'm a big offender of like just cracking my own back and thinking that's going to help me. Is that harmful?
Well, usually not. However, it can be if you do something that's inappropriate or wrong. The best thing is to let a professional take care of that for you. But what happens is when the joint is actually being squeezed together, so the muscles will squeeze that joint down, and as they squeeze that down, it's going to cause pinching. So you'll feel like the need to stretch and pull to try to get that to open back up so it stops pinching. So a lot of people that kind of do that like self-adjustment stuff, they actually feel temporarily better. The problem is it's usually a temporary thing because it's not getting to the actual spot in those deep muscles where the problem is. And that's where going to a chiropractor can help find those exact spots, measure that, and then with treatments you can actually track the progress of that to make sure those muscles actually change. So obviously in one visit you're not going to change a muscle any more than me going to the gym one time and doing sit-ups and suddenly having like expectations I'm going to have all this muscle change. It's not really.
I do that. What's wrong with that?
I wish that happened, right? So a lot of people do that with chiropractic care too. They actually believe that muscle is going to change in one visit. But the reason why they think that is because they think that their back popped out and then you just popped it back in and now I'm good to go, right? And it's just because that's not how it works. There's a lot of disappointment and people who have like bad experiences and things like this or say that it didn't work when really that doesn't work very often for people at all. You can feel better, but to really get that underlying cause fixed, you have to change all those deep muscles, get them to actually work normal, and then strengthen them so that they're stronger and can hold those positions better.
And one thing that you do when people come in and they see you, you want to educate them on all this before you even touch their backs, their necks, anything that they're having issues with.
Yeah, for sure. 20 years of doing this, what I've found is not one person has ever come in actually understanding how this works. And so we have to take patients and take them by the hand because, hey, I'm skeptical of things I don't understand as well. So we want to take people by the hand, walk them through an education process so that they can understand what's going on, so that they're empowered to really take charge of their health, and then that way you can decide what you want to do. But you need to understand how things work before you can have any kind of opinion or a decision about it. Otherwise, it's just ignorant. And we see people all the time that say, oh, I wish I would have known all this sooner. I wish I would have come in sooner. I just didn't understand. I just didn't know how it worked. And so we want to make sure people are in the know. And then that way you're in the driver's seat of your health and making your own decisions.
Absolutely. Well, Dr. Quast, thank you so much for joining me today, educating me on this topic, because I know I was a big offender with, backs popping out. I can stop saying that now. For more information on iChiro Clinics, head to our website. We've got all the details for you online at wzzm13.com.